My name is Dr. Fritz Francois. I am the Executive Vice President, Vice Dean, and Chief of Hospital Operations at NYU Langone Health in New York City. In my role, the main focus is improvement of quality, safety, efficiency, patient satisfaction, while meeting our goals for margins, so our financial goals. And so what we're interested in terms of innovation, first and foremost, is how do we leverage data in order to improve what it is that we do on the domains that I just mentioned. To that end, the use of data can help us with workforce efficiency. It can help us in terms of outcomes for patients. It can also help us in terms of engagement of patients. So as an example of some of the things that we're doing, specific things that we are doing, we are delivering tools to help teams function better as it relates to safety. An example is to try to determine whether there are variances in what is written in a chart and what might be ordered in the chart. And that gap, which can produce safety events, is something that can be closed using technology. On the patient experience side, we are interested in developing and delivering novel tools that will help engage patients around their care. That can also be linked to wearable devices. That can also be linked to ways in which the patients can more efficiently communicate with their clinical teams in various ways. I think there's tremendous opportunity for technology companies to think about how they can partner with organizations to solve some of these issues and to answer those questions around the domains that I mentioned of quality, safety, efficiency, patient satisfaction, and also margin. I think the current AI boom will be completely transformative in healthcare from the perspective of, first and foremost, the workforce. That there are a lot of things that we currently do that with AI, they are going to be done quite differently. A specific example that I can share with you, it relates to, in the current state, we have physical slides for histology, that somebody has to take the specimen, cut the specimen, do certain things in terms of processing, etc. In the future state, where we have digital pathology, there are certain steps that will still need to be done. However, up to a certain point, where now you have the digital specimen, now it's on the screen, that you can apply artificial intelligence to this in order for you to not only be able to detect maybe certain cells, to make certain diagnoses, but pair that with information that exists in the medical chart in order for you to more clearly diagnose and perhaps suggest a therapeutic plan. There are also a whole host of other workflows that will be disrupted with AI based on the current state of healthcare. So, when we think about how we predict outcomes for patients and what we currently do, where we have somebody who is physically engaging with the patient, well, that's going to go away. I think that those opportunities are in the very near future, not in the far future.